All right. So again, thank you everybody for joining. I would like to introduce our speaker for today, Dr. Sarah Verbeest. Dr. Verbeest is a public health social worker who has worked and continues to work to improve health of women and babies in North Carolina. She has served as a director of the Center for Maternal and Infant for 11 years. She's a clinical associate professor in the University of North Carolina School of Social Work, co-founder and director of the Every Women Southeast Coalition, and senior advisor to the National Preconception Health and Healthcare Initiative. So we are very excited to have her and present this webinar. So if Dr. Verbeest, you can take it away, and then just let me know when you need me to change the slide.
Sure, thank you. Go ahead and change the slide.
All right.
Hi, everybody. It's nice to have a chance to talk with folks that are part of the Implicit Network. I think that you all are doing excellent work, and it's definitely an honor to be in your orbit today. So I'm going to talk about the fourth trimester today, and I wanted to start off by making it clear that the work that I'm presenting really represents the work of a lot of different people, including a variety of different types of professionals, community leaders, and new mothers from across the country. So just this slide shows the pictures of some of our team, and that really highlight that we're really working hard to center the voices of women, and particularly women of color, so that all mothers are seen and heard and respectfully treated. And so I wanted to just lift all of them up as I'm getting started. Next slide, please. So with the 30 minutes that I have to talk with you today, and hopefully there'll be time for some good conversation, I'm just was asked to underscore why the fourth trimester matters, to offer some strategies for engaging new moms based on some of the work that we have done, and also just talk about some opportunities and upcoming resources. And also I have nothing to disclose, except I'm a fan of the Implicit Network. Next slide, please. So the mission of our fourth trimester project is really just super small. It's just to transform the lived experience of the fourth trimester by sparking real, sustained change. I have been doing research on the fourth trimester and on postpartum for quite some time. I did my dissertation on the topic, and the background search for literature was very scarce. And you know, this was back in 2008 when I defended that work, and it was just really astonishing to me how little had been published or discussed or talked about this really sensitive period of time. And as we've continued to do our work, you know, we've really found that there's really nothing short of what needs to happen, that we really have to transform this period of time for new moms. Next slide, please. Next slide. So when we talk about the fourth trimester, I'm getting a really strange echo.
Yeah, if you could please, everybody, if you could please make sure you're on mute, except for Sarah.
Okay. I think that's a little, there's still an echo, but it's not quite as bad. So we know that there's this topic affects a lot of women. We have over 4 million new mothers each year. And as our team has often identified, we feel like we have 4 million moms with one universal story. And we talk about the candy wrapper syndrome. So Allison Stube, when she speaks to audiences, talks about the fact that we really seem to care about mom when the candy, the baby, you know, is in the wrapper when she's pregnant. But once that baby is born, we toss mom aside, and we then zoom in all of our focus on that baby. And so what our work, and I think the work that you all are starting to do with Implicit Network, is to say that's inadequate and unacceptable, that moms really matter as well. Next slide, please. this is probably not news to any of you, but when we think about the impact of this particular period of time, there's some really important things to consider. We know that the number of women who lose their lives giving birth in our country has nearly doubled over the past 25 years, which is pretty astonishing considering how technology has advanced. And we also understand that that is more of a tip of an iceberg number, that the number of women who suffer significant morbidity in the postpartum period is also increasing. We know that about 1.6 million new moms don't receive a postpartum visit. So thinking about all of the care that they receive in that build up to labor and delivery, and that after leaving the hospital with a newborn, so many women are not seen in the healthcare system again is really astonishing. We also know that 1 in 4 moms in our country return to work just 10 days after childbirth. They are not going back to work because they're really excited about their jobs. They're going back because many of them would lose their jobs if they didn't return. And also they have no access to paid leave or any kind of support while they're gone. And we know that a lot of moms who experience symptoms of postpartum depression do not get help. And we know that they don't get help for a number of complex reasons. Access for one, but also the culture of postpartum that we've created about this is a time when moms are expected to look like they have it together, and that it's difficult for women to admit that they're having a hard time. So there's a lot of reasons why women aren't getting help. But when you put all of this together, I think it really underscores the candy wrapper concept that I discussed a little bit earlier. And I think also underscores why we are talking about system transformation. Next slide, please. And I put this slide up. I think all of you have heard there's been a lot more energy and attention that's starting to be paid to postpartum. And I think it was really sparked as we started to see this kind of information that showed how poorly we're doing in the US in terms of increases in maternal deaths, increase in preventable deaths. And then what's not pictured on this slide is the significant inequities in who is dying, understanding that women of color are 4 to 5 times more likely to die than white women. And I think that I really give a lot of credit to ProPublica, NPR, and Black Mamas Matter Alliance and other groups who have really turned up the volume on this issue and have kept the volume high and have gone to Congress. And now there's some increase in investment and focus on postpartum health in a way that I think gives us all a really unique opportunity to really lean in this work at this particular point in time. Next slide, please. So this is a quote from someone on our Amelia on our 4th trimester team, as we were really talking about having a really heart-to-heart conversation about this. And she's a mom of color, and you know, she said ultimately motherhood should not mean risking my health, happiness, or life. Next slide. So, having laid hopefully accomplished the first objective of underscoring why this is a really important time to pay attention to, I wanted to share some of the key challenges that our team has found across the different work that we've done. So we had a Patient-Centered Outcome Research Institute grant that allowed us to work for 2 years with a cohort of brand new moms and their babies, community leaders, stakeholders, and different types of professionals. And we have done national surveys and done a lot of partnership with mommy bloggers, with different community groups. And really there are some key themes that have continued to emerge across all of our work. And so as it relates to the postpartum, we have identified that there's significantly a lack of timely, relevant, credible postpartum information. For example, I was looking at one of my favorite kind of books, which is the Our Bodies Ourselves series and Our Bodies Ourselves Pregnancy. I looked at that book, and they had only one tiny chapter that was related to postpartum health and recovery. And I think if you look around, there's just really not great information about how to understand what's happening to one's body during that transition from pregnancy through postpartum into recovery. So this was something that was really important. There's also issues around having information be credible and not tied to someone trying to sell her something. We identified that postpartum care is too little and too late. I don't think any of you all would disagree with that. That women have limited access to care and services. So in some cases, women who are receiving care in public health systems may have one opportunity to get in for a postpartum visit. If she's not able to make that, she will be out of the window of when she has health coverage and is not able to get in. And we also know that women need some additional services to fully recover from childbirth, sometimes physical therapy, urogynecology services, lactation support, mental health services, and these are not widely accessible to all women. We heard that women really have said that they have to figure out what they need and how to get it. So we put a lot of work on the person who needs help to get out there and find her own help. We also have heard about biased and judgmental and misaligned clinical encounters. And I think that this happens for a number of reasons, but also likely because this postpartum visit is not well compensated, and they're not particularly very long, and not all women have the opportunity to actually see the provider who either delivered their child or who provided prenatal care for them. And there's also a lot of cultural and social stigmas and unrealistic expectations about the postpartum period. And so these are some of the things that we need to keep in mind as we're planning forward and thinking forward about ways to improve our postpartum care support and services, is to kind of be aware about kind of the current state of things. Next slide, please. So this is our Blow Your Mind slide. Just to say that for something that some women don't even get a follow-up visit for, this is actually everything that's going on for a woman and her new family during this important 3 months to first year after having a baby. And so there are a lot of particular issues that you'll see in that inner smaller circles, thinking about mood and emotional well-being, how to take care of this a fragile new little person that has entered your life, concerns and questions around sexuality and contraception and birth spacing, sleep and fatigue, which we really don't talk about very much, the basic physical recovery, what to do about medications, different substances and exposure. And we found that we tend to, in some ways, address these circles with different types of specialists, when in fact, women will report, and as I think makes obviously common sense, that if someone who is absolutely sleep deprived and is struggling with pain may then turn to begin smoking tobacco or cigarettes again to feel better and maybe regulate her mood. And so I think women were saying you can't treat any of these particular concerns as single issues because they all have a lot of complexity and that there's a lot of interconnectedness across them. And I think as providers, sometimes when we go through screening or when we think about different types of specialists and who we might work with on different issues, I think the fact that we need to be continually keeping the full context of the woman's life and experience in mind as we're providing her support and resources during this important period. We also know that there's a lot of things that she as a person is trying to adjust to. So understanding her self-identity now in the context of being a mother for the first time or a mother again. One quote we heard that really struck us is one mom said, before my baby was born, I was Rebecca. Now I'm Jacob's mom. And so I think, what does that shift in identity mean? Women are needing to find time to take care of their own selves, take care of their baby, manage larger family care, family issues, family complexities, and also try to focus on relationship care for their partner. So there's a lot that's going on in this period of time that many women are taking on solo. Next slide, please. So moms need a village of support. I think this is really important. We have seen some of this work that we've been doing in partnership with Dan Frayne here in North Carolina around thinking about well woman care. I think it extends beautifully also to postpartum care. We know that there's some of this work that is centered on the women. We also know that how women interact with the clinic is important, and we also know that clinicians have limitations for what they can do, and this is where clinic ties with community supports and resources, such as home visiting programs, is also really important. And so how can we craft together ways to provide this more complex type of support to new moms? Next slide, please. This I put up because if we're going to try to create new systems of care or think about our work differently, at some point we're going to need to have some new investment in this important trimester, fourth trimester. And so we just, this slide represents that there is a business case for providing better care for new moms. And also to be having that community partnership and even employer partnership. We know, for example, that many people in this country do not have paid parental leave. Many people don't even have paid sick leave. And we know that women who are able to take paid leave are 93% more likely to still be in the workforce than other women. We know a lot of women end up leaving the job market because they don't have supportive employers. We know that women who took a maternity leave had fewer depressive symptoms, which says a lot about the intersect between mental health and also all those other responsibilities. And we've also heard that 1 out of every 5 moms who said who quit said that they had a good workplace. So I think we're wanting to ourselves challenge business leaders and other people outside of just clinicians about how we can think differently about supporting new parents. And I think that if we had more support for new parents, that would also make your jobs as clinicians a little bit easier. And so I leave this slide reminding you that you do have the political power of the white coat. And sometimes when providers take a stand or speak up on particular policy issues, that it can have an impact. Next slide. So as we start to think forward about what are some strategies and things that we could do better, it's important that we think about measuring the right things and hold people accountable for the quality of postpartum care. So when we think about our larger system, we do a lot of measurement of infant outcomes, but not necessarily maternal outcomes. So we have, prematurity, low birth weight, adequate prenatal care. We have a lot of statistics that are reported annually in every state and across the country, but we're not really talking about maternal outcomes. And I think that this is something that we should really think about changing, whether you're doing this at a clinic level, a health systems level, or we're looking at it from a payer level. We know that things like screening isn't enough, and we definitely heard that screening for depression isn't enough. We really need to focus on who also then was able to get treatment. And so again, thinking about what we measure, what we reward, and also recognizing that we heard from a lot of moms, and these were very diverse groups of moms, that they routinely will game the depression tool. If it's just a piece of paper, they think about whether or not they want to be identified as depressed and how that would reflect on their parenting. And so they may not be completely truthful on that. And so really stressing that some of this has to be time for a conversation as well, which again is with a very limited time for visit can be difficult to fit in. We also know that pregnancy is a stress test for life. And so how are we helping women manage current and future chronic conditions? So someone who's had, as you know, preeclampsia is at risk in the future for chronic diseases herself, the same for gestational diabetes. And we have very little that we are putting in place to be able to support women. Now, I think implicit in family planning providers have a unique edge on all of these issues because you have the opportunity to create life course relationships with people, which is why I firmly believe that it's going to be family medicine that's going to show us the way about how to do this care better. We also heard that quality family planning services matter, just asking about what method you want to be on. It's a definitely more complicated conversation with new moms. And that also postpartum recovery, it's a process that we heard from women. It's not a single visit. It's kind of this process and unfolding of recovery. Next slide, please. So hopefully you've seen this. So what's really exciting is that we've got some new guidelines from ACOG. Probably not surprising that Dr. Allison Stevie, who is a partner with us on fourth trimester, was also the person that wrote the new postpartum guidelines. So you'll see that there's some really nice synergy, and what I think is really important with these guidelines is that they have recognized that postpartum recovery is a process, not a single visit. And so in looking at this slide, that you will see that they are wanting to make sure that that in the postpartum process that there is now contact with all women within the first 3 weeks. And they have not described if that's a phone call or her coming into the office or a text, but that all women need to have some kind of a contact within the first 3 weeks, and that they need ongoing follow-up as needed from 3 to 12 weeks. That for women with higher risk conditions, we need to be looking at blood pressure checks within 3 to 10 days and high risk follow-up within 1 to 3 weeks for those moms. And that the comprehensive postpartum visit and transition to well woman care really needs to be individualized and woman-centered. So I think this is different from what was the original traditional one-time 6-week visits. And I think clearly we need reimbursement to match these additional visits and additional touches. But I think also some of the work that Implicit and others are doing, you have an opportunity to start to model some innovative ways to approach this, and then to also assess how can this additional contact with women improve their satisfaction, their outcomes, and also for you to help us learn what are their key questions that they ask and their key needs in those first 3 weeks. And y'all can talk more about this later. Next slide, please. Trying to get through this so you have time for conversation. So another part that really came out of the ACOG postpartum guidelines and their bundle is that it's important for providers to think about helping her develop a postpartum care plan and team. So women really need guidance on what to expect after birth. There was a really nice study that was done by Elizabeth Howell that found that 15 minutes of preparing women for what was going to come after they had a baby, women that had that education had a significant reduction in depressive symptoms. So having anticipatory guidance is really important about understanding how they're going to feel after they have the baby is really important. Thinking about lining up community of support is really also something that we, ACOG, and we also would suggest helping people to think about, well, who might be able to help you out if you get overwhelmed with a younger child? Who is around you that can help bring you food and help people think about the support that they have, and then identifying women that have no support and connecting them with resources. We'd also like to see clinics have a list of different types of specialists and providers on hand so that women could already have a number about a behavioral health person that they could call, a lactation person who they could call, who ideally would also be covered under the same network of insurance coverage. We've heard a lot of stories about women working really hard themselves trying to find a mental health care provider. And so we just think the more that a clinic can do to make it easier for women to get where they need, the better. And that in dealing with new moms, being sure to ask what they prioritize and to try to ask more open-ended questions and try to understand for them what are some of their own goals for that postpartum period. Next slide, please. So now I'm talking about something that we're working on kind of in the future. So this relates to the challenge I mentioned earlier about really not having a lot of good information postpartum. And these are some quotes from some of the moms in our studies. So one said, "When I had my babies, no one had answers for me. I felt very alone." Another mom said, "There were not any formal places for information about what to expect during recovery from a maternal near-death event." Another mom said, "I searched for help but got no answers." Another said, "Sadly, I was only given information because I knew what questions to initiate myself." We've also heard from other women that they might hear different information from different providers about what they should do. So they might get advice from the person who's checking them in, different advice from a provider and different advice from a home visitor. And so thinking about having some consistent messages is important. And likewise, if we don't know what is the best thing to do because we don't have great research about postpartum health and recovery, to be honest, and say some people think that this is helpful, others think that that is helpful, try it and see what works for you. Next slide, please. Next slide, please. So one response that we've been working on to this need for information, which came as a priority, is that we're working on launching a new website called newmom.health. This is the first woman-centered, mom-designed postpartum self-care online resource. Next slide, please. So these are confidential, so giving you a few of our screenshots of what it will look like. Every part of this website was designed by new moms, from the colors to the layout to how they wanted to seek information to the kind of pictures that they wanted. It's not a short process to do it that way, but I think that we'll have some good results from it. And we're hoping that this as a resource could be something that Implicit or others use to help create some new conversations and also to address that lack of information. So we'll go quick through these slides and then I'll wrap up next. So this is the top of the landing page. The search box, moms wanted it to be really easy to find what they needed. So the first part of our website, we have scoured the literature and all the resources available to provide the best information that we can around this postpartum recovery in that first 0 to 6 months postpartum. Next slide. We also have a section that's about building my village. And this is about, we have a postpartum care plan, one for mom to do and one for friends or partners that might want to do if, in terms of getting ready. And we are providing lots of different information about kind of navigating relationships, family, friends, finding resources in the community, and also dealing with return to job or school. Next slide, please. We also are engaging a way for women to meet other moms online and recognizing that this is the way that we can bring the diversity of experience to share across moms. And so this is another example. These are all from Instagram posts and mommy bloggers that are working with our project to be sharing their stories and creating new connections. So this is how we'll keep all the information super current and relevant and tailored to lots of different communities. Next slide, please. So that's a little insight into that. We're hoping to launch that in July. We can't launch it until we get a next boost of resources because you can't launch a site that you can't support. So we are hoping that we'll have raised the funds to be able to launch that in July. Some other strategies that we think are really important and why we have put in the part of the website about building the village is that we really need within communities to think about family-friendly places for new parents to connect and to be able to get resources. Thinking about, does your local parks and recs, for example, offer weekend activities for new parents? There's been some work about creating breastfeeding-friendly communities, you know, in signs or restaurants might say breastfeeding is welcome here, so that new moms feel comfortable going there. We have resources on that newmom.health website about online support groups and how moms can build their social media connections. And also, we have been doing a lot of outreach to different home visiting providers and groups. And within home visiting, we've really been encouraging home visitors to help come up with strategies to connect new moms with each other, to be building their social capital, and to be really making sure that when they're with new families, that they're helping them to problem solve around things like sleep and work and balancing family needs, because those are some of the things that really seem to take priority for a lot of moms. Next slide, please. Skip, can you go to the next slide for me, please? Thank you. So this is kind of where we are, and I think this is where we are hoping to build a partnership with Implicit, is that we really want to help us all come together to figure out how we can help moms build a modern village and how we as advocates can be part of building that modern village for all new moms. We really need to be setting new standards for what quality postpartum care and services look like. We need to be testing solutions about how we can provide this care better, and also really prompting, I think, new research to continue to build out our understanding about how to help moms recover. We need to be changing the conversation in terms of expectations around postpartum, about things like moms said that they didn't like hearing words like normal and not normal, because then if they were not normal, they felt bad. So even thinking about how we can shift to have conversations that are very patient-centered and resilient-focused, and then also fund the work. And I think that's, again, something that we all need to work together on in terms of advocating for additional payment and support for the services that need to be provided, and also creating unique care teams and thinking about some creative ways that we can work to be able to reach all moms with the care and support that they need. Next slide, please. So this is a final quote that we really like. The thing about reproduction is that more than anything else, it tells you how a society values people. And we think that at this sensitive period of time, at the formation of a woman's new self-identity, the bringing of a new child into the world, the creating of new dynamics in a family, and also the potential physical risks and recovery to the new mom, that how we address the postpartum period really tells us as a society how we really truly do value moms in our country. Next slide. The last one. So thank you. We have a very active Facebook page, a new Instagram, Twitter, and we are connected with lots of amazing groups and people. So if you wanted to follow us, I think it would also be a quick way for you to tap into a lot of the conversations that are happening. I know Suzanne Woodward is our communications director. I know she's listening in. I really want to give a lot of props to her for the tremendous work that she's done in helping us really build our online communities as well. So that's what I had to talk about, and I think I'm going to turn that back to our host to see if we have any questions.